Hi, this is Dan Smith of DPS Legal Counsel, and welcome to today's video. Today I'm going to be talking about an issue that comes up with respect to physicians who are supervising the practices of nurse practitioners. You know, under Tennessee law, nurse practitioners can have an independent practice, but they have to have a supervisory physician. And every month, the Board of Medical Examiners issues a list of disciplinary actions that have been taken against physicians who have in some way violated the rules that apply to physicians in the state of Tennessee. And on this most recent listing in Tennessee that actually the Department of Health puts out with all the various licensing boards covered, there was a violation by a physician for failing to provide the required supervisory activities or actions with respect to a practitioner for whom the physician was acting as supervisory physician. It wasn't clear in the order or the listing of the order whether that supervisee was a physician assistant or a nurse practitioner, but I'm going to, for purposes of this video, make the educated guess that it was probably a nurse practitioner. The Board of Medical Examiners indicated that the physician failed to monitor, make a personal site visit at least once every 30 days to the remote site of the nurse practitioner, failed to review at least 20% of the records prepared by the supervisee, the nurse practitioner, and also failed to look at the medical data with respect to, within 10 days, with respect to a prescription that had been made by the supervisee for a controlled substance. And because of those violations, the Board of Medical Examiners reprimanded the physician and imposed a $2,000 civil penalty, also the costs of the hearing. So what I want to do is talk about some of the requirements that you need to do if you are a physician who's acting as a supervisory physician for a nurse practitioner. First of all, you can be a supervisory physician for any number of physician assistants or nurse practitioners. There's not a set limit on the number that you can act as a supervisory physician for. You need to make at least a visit once every 30 days to the site where the nurse practitioner or the physician assistant practices. You need to review at least 20% of their records every 30 days. And if your supervisee is writing prescriptions for controlled substances, you need to check the medical data for that every 10 days. In addition, just when you set up the relationship with the nurse practitioner or the physician assistant that you are supervising, you need to enter into a written protocol that you both sign, and that protocol needs to be kept on site where the nurse practitioner or the physician assistant is practicing. Needs to be, like I said, it needs to be in writing. It needs to be signed by both you and the supervisee. It should cover the standard of care. It should cover the classes of controlled substances that the supervisee is entitled to or authorized to write prescriptions for. It should cover be specific to the patient population that is being served, and it needs to be reviewed, and if it needs to be modified or changed, it needs to be reviewed at least every 2 years. It also needs to be made available to the Department of Health upon request. And so those are the things you need to do with respect to the protocol that you enter into with your supervisee. In addition, if your supervisee will be writing prescriptions for controlled substances, either from scheduled drugs, then you need to go on to the controlled substances monitoring database and enter your information as the supervising physician for that supervisee. And to the extent that you cease being the supervising or supervisory physician for that supervisee, you need to notify the controlled substances monitoring database that you've ceased to be the supervisory physician. Those are the main things that you have to take into account when you're going to be acting as a supervisory physician. In addition, I don't know if I mentioned, you need to make sure that you have the appropriate experience or expertise with respect to the type of practice that your supervisee will be practicing. So if your supervisee is practicing in the area of family medicine, you need to have applicable experience or expertise in that area to act as the supervisory physician. All right, I hope that helps. If you take all these things into account, you follow the rules carefully, and don't let these things fall between the cracks, then you should be fine. If not, then there's a chance that you could end up like the physician whose case was mentioned in this month's listing from the Department of Health and the Board of Medical Examiners, that they were in violation of the rules. And of course, no one wants to get a reprimand on their license or to pay a civil penalty. So just make sure that you take care to follow the rules. If you have any questions about what you should do as a supervisory physician with respect to a nurse practitioner or a physician assistant, or if you are a physician assistant or nurse practitioner and you have questions about what your supervisory physician needs to do, don't hesitate to get in touch. I'll be glad to speak to you. And that's it for today, and until next time, we'll see you next time.